Hi, I'm Dr. Ted Cook. I'm the Medical Director of the Emergency Department at Newton Medical Center. Here at Newton Medical Center, we are committed to the safety of our patients, our visitors, our volunteers, and our staff. When one considers preparing for bloodborne pathogen exposure, one needs to look at several different aspects. First, we need to have a basic understanding of what bloodborne pathogens are. Secondly, we need to know how they're transmitted. What modes are they commonly spread by? Third, we need to know how to protect ourselves from those. And fourth, we need to know what to do if something happens and we are exposed to a bloodborne pathogen. The information that will be shared today all comes from OSHA and CDC reference material. What are bloodborne pathogens? Bloodborne pathogens consist of illnesses that are present in human blood. They can infect and cause disease in people who have been exposed to blood or other bodily fluids containing the pathogen or the illness. The list of bloodborne pathogens includes, but are not limited to, hepatitis C, hepatitis B, and HIV. What are occupations at risk? Nurses, environmental services staff, radiology, dialysis staff, dental staff, laboratory staff, surgery, cath lab, emergency response personnel, and anyone who has the possibility of being exposed to the blood or bodily fluid of another individual. How are bloodborne pathogens transmitted? Bloodborne pathogens are transmitted when contaminated blood or body fluids, except saliva and sweat, enter the body of another person. In the workplace setting, this is commonly occurs by sharps, injuries such as needle sticks, or by splashes into mucous membranes, such as the eyes, the nose, or the mouth. Unbroken skin is considered a strong barrier against bloodborne pathogens. However, infected blood or body fluids can enter your system through cuts or sores that may not be readily apparent. What about prevention of exposure to bloodborne pathogens? There are several things that we need to focus on this. The first one being very, very, very important, and that's universal precautions. They are called universal precautions because they should be, I know you guessed it, universal. Universal precautions are designed to protect us from any blood or bodily fluid exposure. They include gloves, masks, masks with eye shields, goggles, hoods, and gowns, or foot coverings. Any of those will protect you against the blood or bodily fluid exposure. And anytime you have that possibility of being exposed, you should be wearing at least gloves and a mask. And preferably gloves, a mask, and eye shield. What about other exposures? Things that are sharp, like needles, lancets, knife blades. Those all have the potential to obviously penetrate the skin. And so how do we deal with those effectively? Number one, take your time when you're using something sharp. Number two, do not recap needles. It's one of the most common causes of needle stick exposures. Number three, ensure that sharps are being placed in an appropriate sharps container. Each of the sharps containers has a full line on it. That full line is there for your protection. If you fill it past that, it increases the risk of accidentally giving yourself a needle stick or sharp exposure. What about other protection? Immunizations, such as immunization for hepatitis B, are very effective. And what about hepatitis C or HIV? There are no immunizations for those. That's why we have universal precautions. What do you do if you've been exposed to a bloodborne pathogen? 3 things, easy steps. Number 1, wash or irrigate the area you've been exposed in quickly and thoroughly for 10 minutes. That will reduce your risk of catching that infection significantly. Once you've washed it, go promptly to the emergency department. In the emergency department, there are protocols that they will institute. These protocols are based on, number 1, a risk assessment to say, is your exposure a high risk or low risk of infection? Number 2, if it's deemed a high risk, what guidelines need to be followed to help you not get that infection. These guidelines will always be based on the CDC guidelines, and they will depend on a variety of factors such as hollow needles or non-hollow needles or laceration, all sorts of different things. That's why the ER is the place to go for that. They know those guidelines and how to assess the risk factor. Once your risk is assessed, they will take that risk assessment and combine it with the results for the source patient's blood tests to make a final understanding of how much risk you're at. You may need to have an immunization against hepatitis B. You may need to have a shot of immunoglobulin to protect you against hepatitis B. You may need to have HIV prophylaxis. It is very important, if you need HIV prophylaxis, that it's started as quickly as possible, because it prevents the HIV from setting up in your body. The longer you wait, the more likely it is to get past the prophylaxis, so we start it quickly. Lastly, you need to make sure and place a notification in Meditech, because that notification allows employee health the information they need to work with you over the next several days. You need to then call employee health for an appointment for the next business day, at which time they will discuss with you your test results. They will also discuss an individualized plan of care for you based upon your exposure. This concludes our training on bloodborne pathogen exposure. If you have any further questions, please contact your supervisor or personnel at the Employee Health Department.